just everything was just blurry. I mean, I was just dizzy. I had to hold on, and that's not normal.
Brian Kuehnl got the scare of his life early this year while he was at work and headed into the cafeteria for lunch.
On the right side, I couldn't move at all. I couldn't lift my leg, couldn't lift my arm. I couldn't see very well on my right side.
Kuehnl works as an X-ray tech at Redbud Regional Hospital in Illinois. He was lucky his coworkers knew what to do.
I could tell Brian wasn't feeling very good, and when I saw his eyes, I knew something was terribly wrong and we had to get him to the ER.
ER doctors at Redbud recognized the emergency and called on the experts at St. Louis University Hospital.
When he presented to the other hospital, paralyzed completely on one side of his body and couldn't talk. That's a severe stroke. I mean, that would have been devastating had we not been able to initiate treatment.
This hospital is part of a growing network of rural hospitals, part of the MidAmerica Stroke Network, operated by St. Louis University Hospital. Started last year, the Stroke Network provides acute care to more than 30 hospitals region-wide and continues to grow.
They make one phone call, and that puts them in virtually immediate touch with one of our attending stroke neurologists. So I was paged as soon as the call came through, and within minutes I was on the phone with the emergency room physician.
The outlying hospitals transmit images, and neurologists at SLU Hospital examine and diagnose remotely within minutes, because in a stroke, every second counts.
If somebody has a stroke where there is a clot blocking a large blood vessel in the brain, those people need TPA, this clot buster, to be able to destroy the clot and open up the vessel again.
What you can see is this whitish area right here is actually the area of his brain that was affected at that time by the loss of blood supply.
Dr. Eli Feen spotted Kuehnl's stroke on the left side of the brain through his images via computer. Kuehnl was airlifted to St. Louis within 1 hour, where he received the clot-busting drug called TPA.
They contacted us immediately, and time is of the essence in stroke. If there's one message that the Stroke Network tries to get out to patients, to families, to hospitals, time is of the essence.
FAST is an acronym to help identify stroke. F stands for face, if a patient's face appears droopy. A stands for arm weakness. S stands for speech. If a patient has slurred speech or can't speak at all, chances may be there's a stroke underway. T stands for time. Neurologists say the faster they act, the better the chances are for full recovery.
It's a proud moment for us in terms of being able to be of help to not only the community in St. Louis, but the community in the bi-state region at large, be able to help these many people.
Dr. Salvador Cruz launched the MidAmerica Stroke Network last year when he examined maps of mortality from stroke in rural regions near St. Louis, and knew St. Louis University Hospital, with an expert team of 5 stroke neurologists, could lead the way in treatment. Right now, the network sees more than 50 patients per month. Patients get the clot-busting TPA or interventional treatment from network doctors.
The thing works. I mean, I'm living proof that it works.
So change is happening, one patient at a time. Do you think you're saving lives?
Absolutely.
And it saved me, because I could have been in a wheelchair right now. And I'm working now. I'm working full time. I'm back to work. I was back to work within a month.
Brian is doing fantastic today, and had we not been able to get to him as acutely, I am afraid that he would not have done very well.
Doctors at the MidAmerica Stroke Network say they are seeing more success stories every day. Today at 58, Brian Kuehnl has many things to look forward to, including welcoming a new granddaughter this fall.
Somebody's watching out for me.